I am in the nurse's station and I receive an order for Solu-Medrol 110 milligrams IV push every 8 hours. I'm going to take that order and I'm going to compare it to my MAR. I'm going to be making sure that I have the right patient, the right drug, the right amount, the right route, and the right time. And then I'm also going to be checking my patient's allergies, and all of that looks good. So then I'm going to go pull my medicine, and I'm going to take my bottle and compare my bottle to my MAR and make sure that they match. And they are both Solu-Medrol. The next thing I'm going to do is look up my medicine in my drug book. The first thing I'm going to look to find out is if I'm given a safe dose. My book tells me that you should not exceed 1.5 grams in a 24-hour period. And my dose is 110 milligrams every 8 hours. So I am giving a safe dose. The next thing I'm going to check is my dilution. My book tells me that these come pre-diluted. And so my bottle comes pre-diluted as well, so that is correct. The next thing I'm going to look at is the rate of administration. My book tells me a single dose over several minutes. I'm given a little bit larger amount, so I'm going to give this over 5 minutes. And that means I'm going to be, after I work my math problem, I'm going to be given 1.8 milliliters total over 5 minutes. Next, I'm going to look up what I need to monitor on this, and after my drug is given, I'm going to monitor my patient's electrolytes, because this drug can cause sodium retention and potassium and calcium excretion. I'm also going to monitor for signs and symptoms of infection, because this drug can cause infection to be masked. Then I'm going to wash my hands, and I'm going to gather my supplies, my drug, my alcohol pads, my syringe, and my label. And if I were given an INT, I would also have my gloves ready. I'm going to start by pulling back my 1.8 milliliters of air. I'm going to then clean my vial. Let that dry. Okay. Then I'm going to inject my air and pull back my 1.8 milliliters. Okay. Then I'm going to place my label on my syringe that has my patient's name and room number, the drug, the amount, the date, the time, and my name as well. Then I'm going to get ready to go into my patient's room. I'm going to identify my patient using 2 patient identifiers. I'm going to ask my patient about their allergies one more time just to be safe. I'm then going to tell my patient what I'm going to be doing, that I'm going to be giving some medicine to them through their IV. Then I'm going to check my IV site, make sure there's no redness or swelling. Then I'm going to drop my bag down to make sure that my line is patent and there's good blood flow, good blood return. I'm then going to wash my hands really well. If this were an INT, I would put on gloves at this time. Okay. Then I'm going to clean my most proximal port for 30 seconds and let it dry. I'm given 1.8 milliliters total over 5 minutes. Therefore, I'm going to be given 0.4 milliliters a minute. I'm going to pinch, use my watch, give 0.4 milliliters, release, and wait for the next full minute to pass. Pinch again, give my next 0.4 milliliters, release, and continue to do that until all of my medicine has been administered. I will be assessing my patient during that time. I will also be assessing my IV site and make sure that that looks good. After that, if my IV is okay and my patient is okay, I would go back to the nurse's station and document the fluids I had hanging, the drug I gave, the amount, what my IV site looked like, where my IV site was, how my patient tolerated everything, and that's it.